Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Stapedial reflex. So first let's look at the principle. So how is this principle? The principle is that a loud sound of 70 to 100. So loud sound of 70 to 100 dB and it is above the hearing threshold. So this is above the hearing threshold. We are writing it as HT, that is for the hearing threshold of a patient, and it leads to the bilateral contraction of the stapedius. So it leads to the bilateral contraction. So bilateral contraction, and this is of the stapedius. The next will be the afferent. So this, looking at the afferent, it is the 8th CN, that is a cranial nerve. So what will be the efferent? The efferent, if you see, it will be the 7th CN, that is a cranial nerve. And let's look at the center. So the efferent is 8th and the efferent is 7. Now what about the center? The center, it includes the superior olivary complex. So we are writing it as SOC, that is SOC, that is superior olivary complex, and this is present in the vein stem. So in terms of the afferent palsy, so when you look at the afferent palsy, the reflex is absent on both sides. So afferent palsy, the reflex, it is absent. So it is absent on both sides. So in afferent palsy, the reflex, it is absent in terms of both sides. And in terms of efferent palsy, so afferent, absent on both sides. Now looking at efferent palsy, it is absent on only on the side of the lesion. So the reflex is absent. So it is absent only on the side of lesion, side of the lesion. So afferent is reflex, it affects both sides, and efferent only the side of lesion. Afferent was the 8th cranial nerve and the efferent was the 7th cranial nerve. And the principle was the loud sound of 70 to 100 dB, 70 to 100 dB, and it is above the hearing threshold of the patient and leads to the bilateral contraction of the stapedius muscle. Now what is the CS? By CS, the clinical significance. So it can identify the malingering. Next is to differentiate the cochlear and the retrocochlear hearing loss. So cochlear as well as the RC hearing loss, HR. And the threshold is decreased in the cochlear hearing lesion. The threshold is decreased in cochlear lesions. So when you look at the threshold, it is decreased. So the threshold is decreased, and this is decreased in terms of the cochlear lesions. So threshold is decreased in terms of the cochlear lesions, and this is because of the recruitment, whereas it is increased or even absent in the retrocochlear lesions. So it is decreased because of the recruitment, whereas it is increased or even absent. So it can be increased or absent, and this is in terms of the RC lesions, retrocochlear lesions. So it also, the stapedial reflex, the clinical significance is that identify the site of the facial nerve lesions. So in terms of any facial nerve lesions, it helps to identify it. So facial nerve lesions, it helps to identify, and its presence indicates that the lesion is beyond the nerve to stapedius. So its presence, so presence of the lesion, it indicates that the lesion is beyond, so the lesion will be beyond the nerve to stapedius. So next concept will be the acoustic reflex decay. So there is something known as the acoustic reflex decay. So here in the acoustic reflex decay, it is a feature of the RC hearing. So this is a feature of the retrocochlear hearing loss. There is a feature of the retrocochlear hearing loss, that will be the 8th cranial nerve lesion, 8th nerve lesion. So a sustained tone of say 500 to 1000 Hertz is delivered. So 500 to 1000. So 500 to 1000 Hertz it is delivered. So it is delivered at 10 dB. So it is delivered about 10 dB above that of the acoustic reflex threshold. So above that of the acoustic reflex threshold. So this is for a period of 10 seconds. So this is for a period of 10 seconds. So this is for a period of 10 seconds and brings the amplitude to 50%. So then the amplitude, it brings it to the 50%. That is, there is an abnormal decay. So there is an abnormal decay. To learn and grow daily like this, please do subscribe.